We live in a world beating with urgency, always moving around. Nothing living in this world stays still. But here's the problem. We, as humans, have stopped moving. Ever since the tech boom, we've removed any incidental movement. The modern corporate role has been engineered for total stillness.
In 2026, we don't have a productivity fund. We have a movement fund. Our white-collar force is nearly 10 million strong, and we spend about 70% of that time completely sedentary, just like this.
We've fallen into a productivity paradox. Workplace dictates that being at your desk equals working, whereas not being at your desk is slacking. The reality, this systemic design flaw is costing employers $15.5 billion, and 53% of your staff are battling chronic neck and back pain, which leads to a cognitive slack, where employees provide empty hours and a cognitive fatigue crisis, in which no amount of coffee can fix.
But hold on, what if you can turn movement into currency? Let us explain.
Introducing our partnership-based wellness platform, FiscalFit. We are an incentive layer that sits on top of existing wellness support systems and aligns incentives across employers, benefit providers, gyms, and sponsors. Users earn wellness dollars in-app through verified activities such as geofencing, reference verification, and steps tracking. Furthermore, a rewards enhanced buddy system is implemented, which is designed to increase accountability, motivation, and long-term consistency. Studies show that employees stay active longer when they have peer accountability.
Our solution synergizes the wellness end goal into a collaborative ecosystem driven by behavioral economics and social accountability. Unlike traditional wellness programs that operate as a single ecosystem model, this structure creates behavioral change while utilizing existing benefits infrastructure more effectively and creating value for external partners. Our solution integrates within existing processes and programs, making its integration simpler and more economical. Instead of competing with insurance companies that have already invested millions in their digital ecosystem, we position ourselves as a cross-partner incentive layer that sits on top of existing systems.
FiscalFit's win-win business model is simple but effective. Insurance companies fund wellness dollars as a short-term preventative health investment. This in turn drives long-term savings through lower expected claims and increased engagement within their existing wellness platforms, overall creating positive ROI. Employers are provided with our solution at no cost to them, but are required to invest effort in adopting the platform and providing it with the end users. Additionally, they will be instructed later on to integrate community-based fundraising initiatives into their corporate mandates, all still under the scope of the FiscalFit system. Ultimately, employers benefit from improved productivity, stronger workplace culture, and higher retention. Sponsors such as gyms and wellness brands contribute recurring funding and integrated discounts that help maintain the platform, whilst in turn gaining brand exposure, customer acquisition, and increased sales. As is clear within the business model, our incentivized plan aligns with a non-profit structure.
Our go-to marketing strategy begins with employer validation, securing early adopters in desk-based industries using account-based marketing and direct outreach to HR directors. We position the solution as a retention and culture building tool to reduce sedentary behavior and improve employee engagement. Once employer demand is validated, we approach the insurance companies by presenting them client demand and positive ROI projections from our platform. Desjardins, Blue Cross, Green Shield, and Canada Life were identified as most aligned with our mission due to low collision risk with their current health support system, wellness-oriented brand positioning, and openness to partner with external ecosystems. Once various partnerships have been established with corporate companies and benefit providers, they go to market strategy shifts to the funding stage. Initial funding will be pursued through government grant by presenting the solution as market validated and aligned healthcare cost reduction priority. Recurring funding will simultaneously be tackled through partnerships with a major gym, nutrition brands, and athletic retailers. The final stage of the go-to-market plan will be a 6 to 12-month pilot aiming to identify possible improvements with the FiscalFit system.
The platform uses a phased funding structure designed to incorporate development and recurring sponsorship revenue. The initial setup and early pilot will cost approximately $40,000 to $50,000, which we aim to fund through one-time government grants valued at approximately $50,000. Simultaneously, we will aim to secure sponsorship partnerships, which would provide us with estimated recurring income of $60,000 to $70,000 to sustain ongoing operations after the pilot period. If unable to secure government funding, we would be forced to alter our timeline, requiring sponsorship funding before the app development and pilot can commence. After the 10-month-long app setup and pilot, ongoing operations will cost approximately $58,000 annually, which we will cover through our sponsorship funding. Insurance partners will fund the wellness dollars incentive pool as a preventative health investment, estimated at roughly $100 to $400 per participating employee annually. Even modest reductions in inactivity-related claims, absenteeism, and musculoskeletal issues can greatly offset this investment, creating positive net savings and supporting long-term ROI. Workplace wellness programs commonly demonstrate returns near 3-to-1 ROI through productivity gains and reduced health costs.
The key milestones that we will follow include 3 phases. Phase 1 includes market validation and capital. Starting as of April 2026, we will leverage our local Western University network to secure corporate letters of intent, then sign an insurance sandbox agreement, and by the end of 2026, secure various grants from the government. Lastly, we will want to sign 3 retailers to give our impending wellness dollars real-world purchasing power. Phase 2 includes execution and scaling. 4 months after the grant and insurance funding, we take the capital and build an actuarial grade platform and launch it for a 5-month corporate pilot. At the end of the 5-month pilot, we'll rebuild the app for a scaled provincial rollout. Phase 3 includes advanced biometrics and ecosystem integration. By 2028, we will integrate directly with enterprise wearables for true minute tracking, further enhancing data collection of physical activity. Lastly, by 2029, we would like to make the wellness dollars spendable directly into employees' corporate health spending accounts.
Our team combines clinical kinesiology with business strategy. By integrating human movement and financial science, this partnership incentivizes sedentary workers with wellness dollars. Collaboration with corporations, insurers, and the government further secure the funding for this initiative.
Why now?
Because we have reached a tipping point.
Rising healthcare costs have created an urgent need for preventative care.
We're the solution that turns this challenge into a scalable opportunity for workplace wellness.
FiscalFit, improving health, scaling wealth.